Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Midwifery and Gold Learning. And today I have a very special guest with me here. It is Dr. Kathryn Gutteridge. Welcome, Kathryn. It's so good to have you here.
Oh, thank you. And nice to speak to you, Kristen, and nice to be invited.
It's lovely to have you here. And you are going to speak at our Gold Midwifery online conference of 2022. And you have a wonderful topic titled Family-Centered Midwifery Care in Practice. Can't wait to hear all about it. But first, before we dive into that a little bit, tell us a little bit about yourself. You are a midwife, you're a psychologist, you have such an amazing broad background. So tell us about your journey and the work you're involved in now.
Oh, right. Okay. So it goes back quite a few years. So I've officially retired from the National Health Service of the UK a couple of years ago. But I'm very typical of most midwives in practice that I loved the job, and the role of being a midwife was so important to me right from early on, not just in my career, but in my life. So it actually means more than a job. It is a passion. It is a calling, if you like. That's the way I think of it. But I trained as a nurse first because that was the way training happened way back in the 1970s. And I don't regret that because it gave me a great overview of health and care and how to be with people at difficult times in their lives. So I don't regret that at all. But when I became a midwife, and when especially I started working in the community with women in their home settings, that's when I can remember saying this, I felt like I died and gone to heaven. Because that was the job that I'd always envisaged doing. So I loved the fact that I got to know women, I got to know their families, and the majority of those women would call me when they were wanting my help for them in labour. And it was a life course of being a midwife with a woman in her home setting and community. So my interest in this area of research started then by experience. And I have to say that that's strengthened and continued. I then started to become more and more interested in how women had that adjustment from being pregnant to being a woman whose body was going to do wonderful things. And I noticed that for some women, that transition was much more difficult. And this is where I started my journey into looking at the psychological adjustment women make. And I did research in my master's degree, and I trained, as you said, to be a psychotherapist and a psychologist, which helped me immensely to understand women and their families.
Yeah. And that's what I thought when I saw that background. I'm like, oh my goodness, what a perfect combination, because it is so important to understand, you know, the transition the woman, the family is going through. But also I can imagine how traumatic this can be, especially with women with a background of abuse or and such, right? So I know you're specialized in that area as well. So talk about this a little bit more there as well.
Yeah, I mean, it's easy to see why someone who's had a childhood where parental love and affection was lacking, and it's not hard to understand how that might affect someone growing up and that transition. But for many women, they cope with those deficits, and they take it in their stride, and they become an adult and almost think, oh, you know, I'm okay, I'm fine. And then they become pregnant, and it's almost like the whole thing revisits them.
Mm-hmm.
So for me, I was so so committed to helping midwives and obstetricians understand
Mm-hmm.
that this may be the very first time that women disclose their experiences around abuse, and it's an important time for us to respond positively. So I've focused an awful lot on teaching and supporting
Mm-hmm.
maternity care workers so that they're not out of their depth and that
Right.
they respond to women appropriately.
Yeah, yeah. And I have to tell you, Kathryn, it's so important, right? Because trauma-informed care has been
Yeah,
coming more and more into the center, and which is wonderful,
yeah,
because it was kind of completely ignored, because for many years the woman's body was, we're having a baby, we're having a body,
yeah,
what can go wrong there, the physical, the focus was always on the physical, and now finally we're getting to kind of more comprehensive
yeah,
picture, where we also the emotions, the mind, anything that goes together with that, and what could be
yeah.
triggered through pregnancy and birth becomes important, and that we're learning about it. And your work therefore is so important, that you're teaching healthcare professionals about this, to and helps us care providers be better at what we do, be better able to serve our families and the communities.
Absolutely, yeah. And remember, you know, many midwives and obstetricians today are female.
Mhm.
Not to say that, you know, it doesn't affect male care providers, it does. But, you know, we can be sat down by a colleague who has a whole history that she's never ever spoken to
Yeah.
anyone about. So I do think it's important to care for ourselves as well
Mhm.
as caring for the women. So it's vital to me to be
Yes.
informed.
Absolutely.
Yeah,
Absolutely. Yeah. Let's also talk a little bit about your presentation now, the family-centered midwifery care and practice. And I
yeah.
had a little sneak peek, we talked a little earlier, and oh my gosh, I can't believe it. It's wonderful what you're going to share with us here about this program, that project you've been working on as well, and the research there is. Tell us a little bit about what we can look forward to in the presentation.
Yeah, I'm just giving you first of all a sneak preview of why in England particularly it has come to a point where maternity care has to be delivered in a way that delivers to families and delivers to women and their babies at a time that's critical. I think for many, many years we have serviced our hospitals and not the women.
Mm,
And today, what we realize is actually if we deliver care that the woman wants in a way she wants it, then the benefits of that from some of the research that I'll share are phenomenal and unquestionable. And I know that some of my academic colleagues would say, if this were a pill, we would be producing it in its millions, because the if you like the outcomes are undeniable, um, just because this is something that we can't measure in quite the same way because it's about delivering care rather than delivering a pill. um, I think we're more reluctant to as an organizational approach to take a leap of faith, but we have to. We can't staff buildings. We have to be
mhm.
with women. So I'm
Absolutely.
hoping to give you where we're at in our delivery of this transformation, but also some of the early outcomes that we're already seeing.
Wonderful, fantastic. And you're so true. It's so right. If it was a pill, we would be producing it, but
Yeah,
this is it is so true. It is so true.
yeah,
And with everything new, or with any change, there often is also pushback, right? There's also some
mm,
barriers, and you will be talking about that as well,
yeah,
because it's old learned patterns, education, it all comes together, and sometimes there is some resistance in that change, where we have care providers or
Yeah.
institutions or hospitals saying, well, it worked in the past, why do we need to do this now?
Yeah.
It didn't work in the past, as we know, right?
Yeah.
And so that's why it is so important to keep pushing forward, to keep on going with this topic, and because it is for the greater good. And now, and this is what you're going to talk about, we have the research to prove it, that is really
Yeah.
beneficial.
It is so convincing. I think it's hard to understand why we haven't done it before. But also it's about upholding the role of the midwife. And the midwife, as we know, is such a vital part of women's health for her pregnancy, but also going forward into her life course. So.
Absolutely. Well, thank you so much, Dr. Kathryn Gutteridge, for sitting down here with me and chatting about your work, your background, and of course the presentation you will have here with us during the Midwifery Conference. It was such a pleasure.
And me too. Looking forward to speaking more.
Thank you so much. And now for our viewers, if you got curious about this presentation here, the title again is Family-Centered Midwifery Care in Practice, and you would like to find out more about the whole conference and all the other wonderful presentations that we have for you, and we'll get started February 1st with our conference. I would invite you to go to goldsmidwifery.com to find out more. And all the presentations are, of course, recorded. They are live and recorded as well. So if you are on call as a midwife or birth worker and you can't make it, the recordings will be there for you as well. So thank you, everyone, for watching, and I hope to see you at the conference. Bye-bye, everyone.